Have you ever misplaced your keys? We all have. But imagine forgetting the names of your loved ones or how to get home. That's a different kind of forgetting, and it's at the heart of Alzheimer's disease. Alzheimer's is a brain condition that slowly affects memory, thinking, and behavior. It's the most common cause of dementia, which is a general term for memory loss, serious enough to interfere with daily life. Think of it like a computer's hard drive slowly getting corrupted. The information is still there, somewhere, but the brain has trouble finding and using it. Understanding this condition is the first step toward helping those affected by it. Consider this. Science is a way of looking at the world, and by looking closely at the brain, we can learn how to fight back against this disease. So, how do doctors start to figure out if someone has Alzheimer's? It's not a single, simple test. It's more like being a detective, gathering clues from many different sources. The first step is usually a long conversation. A doctor will ask about the person's health history, including any past illnesses or family members with memory problems. They'll also want to know exactly what kind of memory or thinking changes the person and their family have noticed. Are they repeating questions? Getting lost in familiar places? Having trouble managing money? This detailed story provides the first important pieces of the puzzle, helping the doctor see the bigger picture of what's happening over time. Next up is a thorough physical and neurological exam. The doctor will check things like blood pressure, listen to the heart and lungs, and maybe run some basic blood tests. Why? To rule out other possible causes for the symptoms. Sometimes memory problems can be caused by things like a vitamin deficiency, a thyroid problem, or even side effects from medication. A neurological exam goes a step further, testing reflexes, coordination, balance, and senses. The doctor might ask the person to walk in a straight line or touch their finger to their nose. These tests help ensure that the memory issues aren't being caused by other brain conditions, like a stroke or Parkinson's disease. It's all about methodically eliminating other suspects. The final part of this initial investigation involves cognitive tests. These aren't like a big exam at school. They're more like brain games designed to check different thinking skills. A doctor might ask the person to remember a short list of words and repeat them a few minutes later. They might ask them to draw a clock showing a specific time or solve a simple math problem. These tests, often called pencil and paper tests, give the doctor a snapshot of the person's memory, problem-solving abilities, and language skills. By comparing the results to what's expected for someone of their age and education, doctors can get a clearer idea of whether the memory loss is normal aging or a sign of something more serious, like Alzheimer's. This is gonna blow your mind. There's a single measurement on a brain scan that can help doctors tell the difference between Alzheimer's disease and another condition that looks a lot like it, normal pressure hydrocephalus, or NPH. It's called the callosal angle. On a brain scan, doctors measure the angle formed by the corpus callosum, the thick band connecting the two sides of your brain. In Alzheimer's, the callosal angle is usually wider, while in NPH, it's much narrower. This simple measurement can be a huge clue in making the right diagnosis. After the initial exams, doctors often want to look directly at the brain. How cool is that? We have technology that lets us see inside someone's head without ever making a cut. Brain imaging, like a CT or MRI scan, creates detailed pictures of the brain's structure. A CT scan uses X-rays, while an MRI uses powerful magnets and radio waves. These scans can show if certain parts of the brain have shrunk, which is a common sign in Alzheimer's disease. Specifically, the hippocampus, a region vital for memory, often gets smaller. These scans are also crucial for ruling out other problems, like a brain tumor, a buildup of fluid, or evidence of strokes, which can all cause similar symptoms. But wait, there's more. A special type of scan called a PET scan can show even more. Instead of just looking at the brain's structure, a PET scan can show its activity. One type, called an FDG PET scan, shows how the brain uses sugar for energy. In Alzheimer's, certain parts of the brain become less active and use less sugar, creating a distinct pattern. Even more amazing are amyloid and tau PET scans. These use special radioactive traces that stick to the abnormal proteins, beta amyloid plaques and tau tangles, that are the hallmarks of Alzheimer's. This allows doctors to literally see these troublemaking proteins in a living brain, providing powerful evidence for a diagnosis. Now let's talk about biomarkers. A biomarker is just what it sounds like, a biological marker that tells us something about what's going on inside the body. For Alzheimer's, the most important biomarkers are those two proteins we just mentioned, beta amyloid and tau. In a healthy brain, these proteins are cleared away. But in Alzheimer's, beta amyloid clumps together to form sticky plaques between nerve cells, and tau twists into tangles inside them. These plaques and tangles disrupt communication between brain cells, eventually causing them to die. Finding evidence of these proteins is like finding the fingerprints of Alzheimer's disease. So, how do we find these biomarkers? Besides PET scans, doctors can look for them in the cerebrospinal fluid, the clear liquid that surrounds and protects the brain and spinal cord. To get a sample, a doctor performs a spinal tap, also known as a lumbar puncture. It sounds a little scary, but it's a very common and safe procedure. In the cerebrospinal fluid of a person with Alzheimer's, doctors typically find lower levels of beta amyloid because it's getting stuck in the brain as plaques, and higher levels of tau because it's being released from damaged brain cells. More recently, amazing new blood tests have been developed that can also detect these protein changes, making diagnosis easier and more accessible than ever before. Once a diagnosis is confirmed, the next question is, what can we do about it? While we don't have a cure for Alzheimer's just yet, science has given us tools to help manage the symptoms and improve quality of life. The first line of defense is often medication. One group of drugs is called cholinesterase inhibitors. These medicines work by boosting the levels of a chemical messenger in the brain that is important for memory and learning. They don't stop the disease from progressing, but they can help lessen symptoms like memory loss and confusion for a time, helping a person stay independent for longer. They work best in the early to middle stages of the disease. Another common medication is called memantine. This drug works differently, protecting brain cells from damage caused by too much of a chemical called glutamate. Think of it like turning down the volume on a signal that has become too loud and disruptive. Memantine is often used for the middle to late stages of Alzheimer's and can help with memory, attention, and language. Sometimes, doctors will prescribe both a cholinesterase inhibitor and memantine together, as they work on different pathways in the brain. It's all about finding the right combination to help each individual person manage their specific symptoms as they navigate their journey with the disease. In recent years, we've seen a huge scientific breakthrough. New drugs that directly target the underlying biology of Alzheimer's. These are amyloid-targeting therapies. These medications are designed to find and remove the sticky beta amyloid plaques from the brain. By clearing out these plaques, the hope is to slow down the progression of the disease itself, not just treat the symptoms. These are a major step forward and represent a new era in Alzheimer's treatment. They are typically given to people in the very early stages of the disease and require careful monitoring by a medical team. But they offer real hope for changing the course of Alzheimer's for future generations. Beyond medication, lifestyle plays a huge role. It's not just about medicine, it's about total wellness. Doctors and care teams emphasize the importance of things we can all do to keep our brains healthy. This includes regular physical exercise, which increases blood flow to the brain. It also means eating a healthy diet, like the Mediterranean diet, which is rich in fruits, vegetables, and healthy fats. Staying socially active and engaged in mentally stimulating activities, like puzzles, reading, or learning a new skill, is also incredibly important.